Before we get started with our esteemed panelists, can I get a show of hands here if you own a fitness tracker or a smartwatch? There we go. Look at that adoption rate in the room. Okay, so in this session, we'll be digging a little deeper into how these wearables, these devices are transforming healthcare and the impact they have on the healthcare sector. Okay, so Saif, perhaps I'll start with you. How do you see these wearable technologies empowering patients towards self-care and changing the way patients' journeys continues?
First of all, assalamu alaikum all. Bismillah ar-Rahman ar-Rahim. As you can see from all the questions that you asked, a lot of people are wearing smartwatches that keep track of their daily lives and their sports activity. But the actual number, going back to what a lot of the speakers said, from the 8 billion population of this world, only around 200 million are actually using smartwatches, which is a very small number. But going forward, the world is evolving. So educating people on the benefits of wearables is very, very important. So the wearables kicked off from a health and fitness perspective, but we want to evolve it in the healthcare business, where the wearables will actually help people or physicians and doctors and the medical community in predictive care, in proactive care. And we actually have a good case with the help of DOH, where during the pandemic, and going back to what Siksek said, the pandemic is the CTO, because it actually allowed us to evolve in the way we deliver healthcare and keeping in touch with patients. So we actually got a product to monitor patients, and since our hospitals were being overflowed, and a lot of them were mild cases. So we allowed them to go home, and we gave them wearables with the endorsement of DOH in that area to monitor their heart rate, to monitor their temperatures, and so on. And actually, one of the patients, while sitting at home, their heart rate went really high and their temperature went high. And the doctors monitoring these patients dispatched an ambulance immediately, which actually saved the patient's life. So it's very helpful. It helps to educate the patients. Today, we use the common term that the patient owns his record, but does the patient really understand his record? So this area is where we want to focus on educating the patients on their own medical records. So when they see their vital signs and linking it to the healthcare's mobile app, and that's what we at SEHA are working on, is a lot of technology investments in areas where we actually utilize that to translate, instead of going to Dr. Google, to actually get medical terms and technology information or medical information regarding their health. What does it mean when my blood pressure is dropped below this? What should I do? At the same time, we want the medical community to adopt this technology, because it's going to take a lot of their effort and time. But at the same time, we don't want patients to come to hospitals. We want patients, and that's part of the longevity, is to take care, improve their health care, look how to live their lives through sports, what they eat. And there's a lot of different wearables out there that support this. And that's where we want to go. And it's something that we really want to invest in. And I believe the UAE is a country of technology and embraces the technology. And we want to support that. And being SEHA and one of the largest healthcare providers in the region, we have a lot of medical records. So part of the data that we get, we can allow our sister companies, such as the Stem Cells or other organizations within the Pure Health Group, take this information to do more studies.
I mean, fascinating anecdotes there. You touched on a couple points. I will come back to that later. Mohit, so Ultrahuman, tell us how your business, in a more private perspective, is transforming healthcare and perhaps also fostering accessibility and inclusivity.
Absolutely. So I think Ultrahuman is a biowearable company. We make biowearable devices. The one that you see in my finger here, and there's one on my arm, which is like hidden, but essentially it's a glucose monitor, and these two data streams essentially integrate and tell you more about your own body, right? So I think you just mentioned that there are health records, but are these health records being understood by people? The translation of these health records into more human understandable form, so that it becomes more actionable, is something that we actually do. And we do it in the form of a wearable, which you can wear on your finger, on your arm, and of course, like over time, we will come up with more friendly wearable form factors. Now, I think the way to understand wearables today, obviously from a numbers perspective, it's 200 million of the entire world, but if you look at the active wearable base of the world, it's still like 70, 80 million people who actively use wearables on a daily basis. It's sort of like a drop in the ocean if you really think about it, right? Because the amount of impact that wearables can have, not just in terms of critical intervention, which I think was a great example, but also in terms of like studying human health, understanding preventive aspects of health, and also post-care scenarios where it could potentially lead to obviously reduction of fatalities and even cost reduction for the entire demography. And I think more progressive the economy, the more progressive the country, more proactive they will be in terms of the health agenda that they'll have essentially. So I think wearables pretty much fit in a way just like personal computers used to fit in 1980s. And in 1980s, everyone used to say that like personal computers are for the niche and for the geeks and for the scientists and for the mathematicians. And today, wearable devices are actually for fitness folks and athletes and a lot of such people. But I think eventually, as it becomes more palatable for everyone else and everybody realizes the value that this is useful for their own health, just like personal computers, the wearables are also going to become ubiquitous in terms of usage.
I think what I'm hearing here is that the demand is definitely increasing across different industries and sectors within, the public. And fascinatingly enough, when I looked into the real-world case use of health tech into the economy, the value add, I found that augmented reality and virtual reality accounts for, well, it's forecasted to contribute to up to $350 billion by the end of this decade, purely by the healthcare sector. And so I guess my question to our panelists is, how do you envision augmented reality to enrich and enhance patient care going forward? Saif, perhaps, if you want to take the lead on this.
This goes back to what I said earlier was patients own their medical record, but do they really understand their medical record? But going through augmented reality allows patients to understand what could happen to them. How can they prevent themselves from getting into that scenario? Or a lot of patients, probably some doctors, unfortunately, do not speak the language of patients. They speak in medical terms that not everybody understands these medical terms. But through augmented reality, you can explain to a patient, how's the procedure going to be? Where are they going to actually operate? What are the exercises that they're going to be needing to do? And through the wearables, by the way, they don't have to do it at the hospital while they're sitting at home, and the doctor keeps track. Again, from a hospital, we don't want patients to come to our hospitals unless it's really needed. So we can monitor them while they're sitting at home doing their exercises, and we can keep track. Are you cheating or not? Even when we come to people who are on a diet plan and what sort of food that they could eat and not eat, and relate to it. Augmented reality helps people to envision what's something that they're unaware of.
I guess that helps with bringing awareness and education as well to the larger public for people who were not perhaps diagnosed with anything, but it's good to know as well. Mohit, your thoughts? Any perhaps real world use case scenarios you can share with us?
So I would just like to add to, I think what Saif said, that wearables generate a lot of data. Like, I think, so we generate, for example, almost 85 to 100 MB of health data every day on an individual, right? So we understand like a lot of aspects of how they eat, how they sleep, what they eat, and essentially how they move, their recovery patterns, years and years before actually disease or any disorder has started to manifest. But the problem is that this is just data. Unless you can actually make sense of data, you can't really change the human behavior. Now, what augmented reality does is that it helps essentially create interfaces that you can use to create some of these interventions for people. Exercise is a great intervention with augmented reality, right? It can potentially accelerate delivery to millions and millions of people who can't visit a physical place. But even, let's say, educating people about their own health, right? So there was this, actually there was an African study in terms of like people understanding adiposity and visceral fat, essentially. And a lot of that was understandable by people when they understood their DEXA scans. And before that, they were like, oh, fat is equal to fat is equal to fat, but doesn't really like how adiposity or how essentially visceral fat is different from like any other form of fat in the body was something that people did not understand. And I think once that was delivered in a visual way, I think people understood it in a much better way. So I think this technology has the potential to change, obviously, care delivery, as well as the true impact of data on human health in a significant way.
Yeah, I mean, it's fascinating to hear as a consumer, as a user, how things have transformed. And so if you mentioned before the pandemic, that's been a recurring subject. We've all witnessed since the pandemic how it has accelerated telemedicine. I want to hear how, going forward, do you envision patient data gathered by these wearables to help physicians, wherever they are, to do a better job going forward?
From that perspective, who's better than your own physician to know who you are? But now with the integration of the wearables to any EMR, and as long as the data is mapped properly to your EMR, it'll allow any physician to know who you are and what's your medical history, and to combine it. And even if you go to the private sector here in the Emirate of Abu Dhabi, we have Malafi, where that is all the information gathered by the DOH for the whole healthcare business. So not every patient needs to come to my medical facility to know his medical background, but through this portal developed by Malafi is to bring in all this information. Sharing radiology, reducing patient risk from radiation and so on, from radiology images and so on, reduces the risk on patients, reduces the know-how or knowing his medical history. You don't have to take him through it's intensive and a lot of painful treatments just to come up to the same conclusion that already another physician knew about. So this actually helps in building the background and historical data of this patient, and then they can do studies regarding this specific sickness. Like we all know that our fingers are not the same. So that means that proves to you that not every human body is the same. So by gathering a lot of data, you can predict different body types or different blood types react to different sicknesses. At the beginning of the pandemic, I remember they said a lot of the people who are O- or O positive, I can't remember, are asymptomatic to the pandemic, to the coronavirus, whereas other blood types are susceptible to getting really sick from this sickness. So these studies actually proved that. So having this information and having the devices that help you to gather all this information lets you build better clinical studies and so on. And going even back to the AI learning that the gentleman previously said, the amount of data, AI helps you to process this data so much faster than individuals doing it. And that's the biggest advantage that we have today. So they're complementary to one another. So technology today needs to be utilized in a way to complement the way we deliver healthcare and the way we can predict the future for the healthcare and maybe come up with studies on medications to improve the healthcare adaptation today.
Before we get to Mohit, I want to play devil's advocate. As I'm sure people are in the audience with me, there's a whole nuanced subject around data privacy and censorship, and that's been a recurring theme here, data. What would you say to people who are cautious about sharing information, whether it's to medical providers or just generally to the public? I understand their benefits, but yeah, your thoughts on that, please.
So patient data is obviously very, very sensitive data, and it is personal data. But there are different laws and regulations from an information security perspective that regulates how data is shared. And obviously, patient names are not shared so that you don't know who this is. But some information and data should be flexible enough for us to gather this, because at the end, this information helps us to proceed, innovate, improve the way we deliver healthcare. Because going back to the point I just said earlier is, different blood types react differently to certain medications or to certain sicknesses. Without enough data, we can't prove it. It becomes a hypothesis, and the hypotheses are always built to be proven, whether correct or wrong. So I believe patient data is again, it's very important to keep the data secure and whose data it is. But this information can be used to innovate, breakthroughs in medical capabilities, in pharmaceuticals, and in all that. It's an ecosystem that needs to work together.
Mohit?
I think the way to look at data is think of it like energy, right? So a new energy source will always be dangerous, but equally impactful, right? So what I mean by that is you need data across millions and millions of nodes. In this case, nodes are people, to understand and do, you can say, distributed trials across millions of people. Like to understand whether a certain blood group type is actually more susceptible compared to the other one. And that's one factor. But then let's say, what about people who get more REM sleep versus not, people who get certain type of deep sleep pattern versus not, and having, let's say, lower SpO2 levels already having sort of like a higher level of exposure to viral diseases. So those are all hypotheses that we can, in some ways, crowdsource and prove. But I think, this is the eventuality, that more and more such health data, because of wearables, will be made available. At the same time, it becomes a tremendous responsibility on all of us to ensure that this sanity is maintained. I'm sure, because there is no disruption without stress, there is going to be some stress in the system, which is going to be some systems will fail, and a lot of people are going to, some people are going to have data troubles along the way. But I think the roadmap pretty much looks like if you can ensure anonymization, and eventually, you can argue potentially that one way or the other that whether putting data on blockchain is the right way or not, but anonymization and then giving distributed control to people might actually be the right roadmap here as we think about more robust systems. But I think we are still too early. We're talking about amount of data that gets generated on people and their sales click patterns today versus healthcare data. I think the ratio I've heard about is 1:5,500. So essentially, that's the ratio that we're talking about. We still have much more data on how people buy than what's happening inside their own body.
I mean, it's definitely admirable what the UAE and certain startups like yourself are doing to stay ahead of the game, like you mentioned, is very early. And to me, that means it indicates opportunity for investment. I'm looking at the time here and I'm conscious of time, and I would love to open up the floor to questions if we have any. There, I think if we can get a mic to that gentleman in the middle.
Hello, good afternoon. Much better. Hello, thank you so much for the discussion, very interesting. My question is very simple, directed to Mr. Saif. How long before we can visit SEHA in the metaverse?
You want the honest answer? I don't think that metaverse is the right way to go for SEHA at this moment. It's still, I don't want to say it's in a trial phase, but again, how does it add value to the patient? Because the patient today, maybe we can utilize telemedicine, because today, if you're a human being and you're sick, you really want to see a physician. And the physician, it's either you see him through a video call, like telemedicine, or if you visit one of our facilities through telepresence, that's something that we're going to introduce. But overall, metaverse is different from, in my opinion, or should not be used as augmented reality, because I would prefer that augmented reality to be used for educational purposes, so people can relate to and understand. And it's actually their physical body. That's the augmented reality advantage over metaverse. But metaverse being used in SEHA it could happen, but I don't envision it happening anytime soon. And plus, when you read the news regarding it, a lot of people are pulling out from it, and they're not investing too much in it, and their security is not that great.
Thank you, Saif. Any further questions? Yes, one perhaps on the same table.
Thank you. So I have a question to Mohit. Congratulations on your company. All of my CrossFit colleagues are wearing your device, so it's really working. So my question is, what's coming next for your company? So I can see it's very interesting the first month from the user perspective. You get loads of insights, but then the curve stops a little bit. But for sure, you have something in mind for the coming future from the user perspective. What more data and analysis will be available?
So the way I've understood the question is that what's the next evolution of the platform, like so that we keep people interested? I think so. There are two axes to this. One is richer experience on the same data that you already have. Like how do you use, let's say, the glucose data and the sleep data and recovery data over months and years to improve yourself? And the second axis is more biomarkers. So we are looking at potentially looking at ketones, continuous ketone data, essentially lactates being sourced through your body and onto your smartphone. Combination of lactates, ketones, alcohol, etc. All of those data sources to come in very, very soon. And this is very, very rich data on human performance, but also for, I think, general health. Think of ketone as a marker, like to understand how your body plays with alternate types of fuels, and when does your body burn ketone versus glucose. I think it's good to understand that versus understanding lactate threshold for the human beings. I mean, for people who train for sure, for CrossFit athletes, I think it's a huge advantage, as you would have heard from the world of cycling. So I think that's one core area for us in terms of growth, where we add more biomarkers and create more experiences for people. From existing use case perspective, I think we see the platform more as an occasional use platform where you essentially go on the platform and do missions. Essentially, you sort of like have a 3-month mission to get better, look at your data, and actually action on it, and then you stop because data is also overwhelming, right? So, and data is also stress because it is asking you to change. So when something is asking you to change, you can't be on it always. So you have to use it for a certain amount of time, finish the mission, and then get on to the next one. Recover and get on to the next one. So I think that's how we are thinking about the platform.
I would like to close the conversation with a quick question. What's your dream device? If there was a wearable tech device that, you know, in Utopia, I would love to hear. Saif, any thoughts?
Nothing on the top of my mind, honestly.
No, nothing. It's all happening in the process.
From a wearables perspective, like again, I'm not promoting Apple, but Apple has really advanced their Apple Watch, and it was really impressive to see it. Like if you have, God forbid, someone gets into a car accident, it will call 911 or call the emergency number. Devices like this would really help. Devices that helps reduce sepsis after operations and so on. Devices that really add value to the patient life. We have an old population. We want to take care of our mothers and fathers and our older generations. For them, it's new, something that they don't understand. But as soon as they see the value of it, those are the devices that I really want to see. Helping people link and actually take care of their health.
Thank you. Mohit?
This is a great question. So many ideas. I think top of my mind, I think would be insulin. I mean, I know that there are glucose trackers out there, but what we're really chasing is like, what are the variations of insulin in the human body? And it's phenomenally hard to, I mean, it requires an invasive test to actually figure out insulin and its patterns. And given that metabolic disorders are almost 88% of all chronic disorders, I think insulin could become like the core biomarker that we could keep solving for the next few years, maybe for the next few decades. And the second one could be like an inflammatory marker, a real-time inflammatory marker, because that's an entire domain of disease that we haven't really looked at. While all of these factors, cofactors, like sleep, movement, etc., affect inflammatory markers, but I think getting a sense of the actual marker would actually change the world.
Well, there's some food for thought for entrepreneurs and investors in the room. Thank you so much, gentlemen, and hopefully see you around soon. Thank you.
Thank you.
Thank you so much.